of us at O Health, we are glad to be here on the first edition of Health Talk series this beautiful year. And believe me, this year is a year full of beautiful opportunities and pleasant surprises. So we believe that with you staying healthy, you can achieve it. And that's why we are bringing with you a very interesting topic today on our first edition of Health Talk series. And I have a guest with me today. I'm so excited. She's starting the year with us. Yeah, some of you might have seen her, you have seen some of her posts, her videos, but she's here live with us on our first edition of Health Talk series. I have with me Dr. Temitope Farombi, the CEO online health company O Health. So she'll be discussing preventive health versus curative health. At the end of this interesting health series for this week, we will be convinced to know which to stick with, preventive or curative. So let me just quickly take us through what preventive healthcare is and what curative healthcare is. So preventive healthcare is targeted at improving and maintaining your health, while curative is just restoring and maintaining. So she'll be telling us much more. So my very first question to you, Ma, is that which is better, which is safer, and which has a greater outlook, preventive or curative healthcare?
Thank you, Damlola, for having me on your show. It's a wonderful show and I love listening, and I hope our viewers also enjoy the show. And this is a very important topic for the year. Like the saying goes, prevention is better than cure. So obviously, to prevent is better than to treat. And also, another saying goes thus, is teach in time saves 9. So if you are able to prevent diseases from happening, then you would have saved yourself 9 times what you would have spent in time, in your value, and also in money when it comes to you having to spend money on your health. Like what the very common one is vaccine. Like to treat tetanus, to prevent tetanus infection is less than 500 naira. With tetanus toxoid. But to treat tetanus infection is over 500,000 naira.
Wow.
And the chances that you will make it is less than 50%.
Wow.
And that even if you make it, what is the quality of life you will live afterwards? So you can see, to prevent with less than 500 naira and live a full and quality lifestyle, than to then save and to pay 500,000 naira to treat the disease and still not have a quality lifestyle. So I tell you, I will kill behind preventive health rather than focusing on curative health.
Wow, that's a very beautiful one. And the next question I want to ask is, in your year of your medicine field, like your practice, what would you say, how would you rate people's going more to preventive than curative health? So in your years of practice, do people come more to the hospital for preventive or curative? And what is your perceived reason why they would pick to any of those?
Okay, thank you. By personal experience, I see people putting their health at the back end of their life's priority. That's my own personal experience. I've seen people talk more about partying, wearing clothes, eating junks, and not putting their health as number one priority. Like, if you spend 100% of all your health energy in pursuing wealth and you neglect your health, you will spend 100% of the wealth gotten to pursue 20% of your health. To regain 20% of your health. So it is important. Over the years, I've seen a lot of people, they rather buy clothes than go and do a checkup.
Wow.
They rather party and drink and forget and pursue other life events and forget to do their screening.
Mm.
We say that any young woman at age 30 and above should do cervical screening. To do cervical screening, cervical cancer is one of the cancers in the world that you can cure if you are able to detect it early. So to do cervical screening saves you a whole lot of troubles and emotional, financial, even pain, than to then experience cervical cancer. And then you know that your life is cut short even in your prime.
Wow.
So what is that essence? So over the years, I've seen people forget to even check their blood pressure. To check blood pressure is as cheap as less than 100 naira or 200 naira if you go and check in the health center. But to treat complications that come from hypertension, you may not even survive it. And I've seen a lot of people come down to the hospital with preventable diseases like stroke, like heart attack, like diabetes, and it's because they've neglected their health.
Wow. Wow. I wish people would actually make up their mind this year and stick to preventive healthcare. And that's going to lead me to my next question. So most people have the belief that this preventive healthcare, so it's like generally called medical checkup, is only meant for the elites. I don't need to check. When I'm sick, I'll treat myself. I don't have the money. We only hear that it's only our politicians or the rich people that do preventive healthcare, which is medical checkup. So what's your take on it? Is it the mentality or the money, or why people just shying away from this preventive healthcare thing?
Thank you. I think it's more of mentality and perception. Okay. It is what you make your priority. Some people spend a whole lot of money on things that are ephemeral. What do I mean? You can decide to put money to buy data to watch social media.
Yeah.
So that is your priority. But to go and check your BP, you say, I'll check it later. But I tell you, the rich man or the politician that have made having to do regular checkup a habit, is because they know what life is. For them, life is beautiful and they don't want to die. So they understand the importance of staying healthy to be able to enjoy the wealth gotten. Unfortunately, you don't have money, you don't have that so much wealth, and you're now sick. Who will take care of you? So you can see the difference when you take care of yourself. What is wrong in putting at least 50 to 70,000 naira aside to do your full body screening for the year? At least you'll be sure that you are fit, and perhaps maybe if there's anything that is ongoing in your body that you did not detect or that is not apparent, you'll be able to save it and be able to quickly attend to it, rather than then looking for 500 or 1 million or 10 million and be asking people to help you, to support you, and even the outcome is not guaranteed. Wow. So you and I know that the former is better than the later.
So from what I've been able to get from what she just said is that many people don't set their priorities right. So some people, life is beautiful when they party, when they buy clothes, when they eat junk food. While to the rich, life is beautiful when they pay much more concern to their health and then they enjoy it. Wow. Beautiful viewers out there, I hope you've been able to learn something from what Dr. Farombi has said. It's not too late. January, we're just in January, the year is just starting. So why don't you pitch and go do your preventive health checkup? And she's going to be telling us what O Health has for us this new year as regards preventive healthcare. So what is O Health offering us this year as regards preventive healthcare? At least you have stated the problem, the solution. What
yes, thank you. At least we identified the problems, and that is why we came up with solutions. And one major solution is that we don't want you to be sick before you attend to your health. So Health has come up with a package, different packages that suits individual person. such as men health. For we have a product that is called men health. This men health includes both screening of different, your liver, your kidneys, your heart, your prostate, and also on top of that you have opportunity to talk to a specialist who will help you to identify areas of need and quickly intervene. Also we have women health. This women health also, it's a package that we have come together that okay, when you do this screening we can then advise you on what to do for the year so that you stay healthy throughout the year. Then we have general health. That is for general people. You want to check your eye test, you want to do dental screening, you want to do your genotype. Maybe you are planning to get married and you want to know your genotype. So you can also, we've actually in general we've put hepatitis B. Reason why we have put that hepatitis B is that it is one of the commonest infection that is easily transmissible in the community, and people pay less attention to it. And if you are able to screen for hepatitis B, if you are negative and you have not been vaccinated, we will advise you to go and take your vaccine. But if it is positive, because the risk of hepatitis B is that it can lead to chronic liver disease and also liver cancer. So if it's positive, there are ways we can treat you and manage you such that the hepatitis B infection in the liver will not progress into liver disease or liver cancer. In some cases, the management can even lead to complete cure. So that is the reason why it is important for you to be able to screen yourself and know. And that is the package that we have brought, and many more.
All right. Thank you very much, Ma. It's nice having you on today's Health Talk series. And I'm sure our viewers out there have learned a lot. Okay, so you want to subscribe to this Preventive Healthcare on our platform, just go to our website www.ohealthng.com. You'll be able to see the full packages she has just mentioned. So don't procrastinate, like she said, and pay good priority to your health this year. Your health is important to you. Like it's commonly said, a healthy people, a happy people. But before we go this week, we did a trivial question on our social media, on Instagram or Facebook, and we have winners.
Wow.
And we'll be giving them something to accompany it. So I'll just quickly read out the questions and the winners and the answers to us. So the first question is, jaundice produces yellow pigmentation from which substance? The answer is bilirubin. So that's where jaundice produces yellow pigmentation from. The second question is, what condition is referred to as low oxygen level in the blood? It's called the hypoxia. Then number 3, where is an axillary temperature taken from? It's taken from the armpits. Number 4 is, what gives the human body erect and upright position? And that's the spine, the backbone. And the number 5 question is, as iris is to eyes, pinna is to what? The answer is ear. So all these 5 questions were correctly answered by 3 winners that I'll be announcing right away. Because we told them that at this live show we're going to be announcing the winner. So the first person is Princess Temi 76. You're our first winner for our trivial question that we normally post on Tuesday. Our second winner is Bumi Bay. That's what, at Bumi Bay, you're our second winner. And our third winner is at I am Benny _A. So you're going to have, we're going to fund your wallet, that's your O Health wallet, and you're going to be able to talk to any doctor of your choice. So we're going to reach out to you, fund your wallet, and you're good to go to talk to any doctor of your choice. And we'd love to hear your feedbacks so you can encourage other viewers out there that the O Health app is available to speak to a doctor anytime, any day. Thank you for staying true and staying tuned all through last year, 2021. We really appreciate your comments. We are glad that you've been following. So this year we have a bigger and better package for you. Don't miss it for anything. Stay tuned for our next Health Talk series program, which is coming up soon, now that you can imagine. Thank you. Follow us on our social media at ohealth.ng. Catch you later from Dr.
Bye.
Temitope. What do you say to our
Yeah,
viewers?
to our viewers, keep listening, make your health your priority, and stay healthy. We love you to stay around for a longer time.
Yeah, bye.
Bye.